Hi, I'm Carl Relf from Cumbria County Council, and with me is Kate. Kate.
Good morning, I'm Kate. I'm the manager of the digital team at Cumbria. Carl's one of the team members. I'm going to let Carl do most of the talking because he's the one that's done all the hard work on this, but just as a bit of background and introduction to it, Cumbria have been using a low-code platform for the last, coming up 2 years now, isn't it, Carl? And we've been doing a lot of work to look at redesigning processes internally. Through the COVID stuff, though, all our resources have been pulled on to looking at various elements of supporting the COVID response. So firstly, vulnerable people, secondly, PPE, and then thirdly, the major piece of work that Carl's been involved in, which is track and trace.
The service had contacted us and had said we need to set up a contact centre. So organisations, predominantly schools in the first instance, could contact us and tell us if they've got a positive case, and we would then be able to start to trace those individuals. So that's where we started. We started with this contact centre. Now, to assist with that, the actual tracing was going to be done by an NHS team. The NHS team were actually responsible for sexual health and tracking and tracing those with sexual health issues. So what they had is they had an existing solution in place, which was an NHS solution. They had a vast experience and knowledge within the area. However, what they were unable to do was they were unable to develop their solution within the timescale required. So at that point, we started to look at whether we could build something in-house as a replacement for their solution and cascade that to our wider partners. What we were able to do is we were able to develop a solution. Again, that was actually done within 12 days. So from initiation to having something workable within the services and across our partners, we were able to have a solution available. That included our Liberty Converse and Liberty Create. So we had the contact centre set up and sat on their seats ready to take calls. And we also had Liberty Create within multi-agency partners there as well. So we have a concept of we have the person. So initially a school was contacting the contact centre and they were providing us details of people who've had a positive test. So the contact centre are able to capture that detail from the school and are able to create a person. So within the solution, they start to create people records. So these are people who've had positive tests, and we can triage these to the multi-agency partners to then start the next part of the process. What we then do is we capture the organisation that that person's related to, and we create relationships to these people. So straight away, if we were to look at any school within the system, we can see how many people are associated with that organisation, with that school. What we then are able to do is our multi-agency partners are then able to contact each one of these index cases, each one of these positive people, and we are able to start to create links to contact cases. So this is the test and trace around, hi Carl, I can see that you've had a positive test, who have you been in contact with? And we can then start to create relationships between my contact cases. And again, keeping our relationships through the organisation. If we're looking at an organisation, we can step through to the person, and then we can see from that person the number of contacts that that person has had. Now, the next level from organisation, we are then able to group or start to create an incident. So if there was a number of people at an organisation who were positive, but what we're able to do is we are able to create an incident and link an organisation to that. So the incident then groups together all of the people and the organisations through the existing relationships. And ultimately, if these incidents are to start continue to grow, what we're able to do is we're able to link those further and create an outbreak. Now, it's the incidents and outbreaks that have been discussed daily at the moment at our incident management hub, And again, with the way that we've built the system, what we're able to do is, when looking at an incident, you can count see a count of the number of organisations, the number of people, and ultimately the number of potential contacts that are associated there as well. So with setting our data up in this format, we're really able to drill down through those relationships and to identify exactly the scale of that incident, or ultimately the outbreak. Our person really follows a process. Now, what this process is doing is it's once we've contacted a person, we need to do these 5 steps afterwards. And having that within a predefined process helps us to make sure that we've got an audit log of all the times that that person was contacted. Also on the person, we're able to capture whether they're an index case, a secondary case, or a contact, and depending on that choice decides on the process that that person follows. And as I said earlier, we're capturing test results and we're linking to contacts also. On our organisation, we've got key contacts. We're capturing specific details around the school or an organisation. Once it comes to incidents and outbreaks, like I said earlier, what we're doing is we're capturing all of the people underneath that incident and outbreak, and we're able to do various things. We've got notebook functionality, so we can capture key actions, we can capture an incident owner, and really have that one version. There's a couple of screenshots on the screen here. Now, what we're able to do is we've done heat maps, we've published the number of tests that we've had done, we've published the number of interactions that we've had through the contact centre. And what we've been able to do is we've been able to build this comprehensive suite of reports, which we can publish to users of the system. So they can really start to capture and see that big picture around what's actually happening in Cumbria. Now, what we've also been able to do is we've also been able to strip out some of that confidential data, and we've been able to make some of that data open to other colleagues as well. So we've got a core group of users of the system, and what we've been able to do is open that up to multi-agency colleagues as well, where within the security restrictions. So heat maps, postcode lookups, all this sort of thing has really helped to capture that data. And just a couple of slides towards the end here, visible results. You may or may not have seen that Carlisle had an alert published at one point. So again, this is a screenshot of tweets that have been published. Now, this data was all captured within the Liberty Create system. We've been able to publish alerts to the general public to say, go and get tested. Here you can see the organisations that are affected, and obviously within the system we have got all of the detail around potential people here who were positive and their contacts as well. We saw an increased number of demands. I think one of the mobile testing centres here in Cumbria had its busiest day the day after this tweet was published. So we really have been able to see it end to end. We've seen the incident growing, the potential for an alert, and then once that alert's been published, we've then seen the increased amount of interactions coming in and people being logged. And finally, just a little note around the positive feedback. There's a screenshot on the screen here now from our Colin Cox, who's our Director of Public Health. You can see there that we're saying around praising the team, praising our contact tracing team, environmental health colleagues around that. Now, where the system at the moment is being used by numerous of people, like I've been saying, we've got public health, we've got NHS using it, and we've also got our 6 district councils, environmental health teams using that system as well. And the number of cases that we're logging in there is growing. It's not necessarily growing around positive people, but it's growing around information around contacts, potential cause for concern as well. So, like I said, positive feedback received, and we've really started to see the benefit from that. We have also been able to share our solution within the Liberty Create community.